When we think about substance use in general, and when we think about marijuana use in particular, you'll see effects throughout the body. So you can see effects on the brain, its development. You can see effects on the heart rate, on the lungs, on breathing, on the muscles. When I work with students, when I work with learners, I'm constantly telling them, give me a body system and I will tell you how substance use affects it.
Whenever we think about their brain, it decreases their ability to problem solve, decreases attention span, and impairs their ability to concentrate. So this really affects them whenever it comes to school performance. They're not going to be able to pay attention, they're not going to be able to do well on a test, and they're not going to be able to retain what it is that they're learning.
When we talk about adolescence and we talk about developing bodies and we talk about growing children, we want to be very mindful that these types of substances can have long-term changes and effects on the brain and the physical body's development.
Adolescent brains are in a very special spot where they're fine-tuning how their brain is going to be wired when they're adults. Their prefrontal cortex is still developing, and other areas of their brain are doing what we call pruning. When adolescents use marijuana regularly, it acts on receptors in the brain. So that affects how the brain responds to certain stimuli. It affects how it releases neurotransmitters, and it affects how the brain is pruned. Because their brains are developing long-term, marijuana will affect that development and can alter the way that they think, that they process events in their life, and it can affect their mood and personality.
When we're talking about the developing adolescent brain, what we'll see is we will see that the brain structures can actually change based on what exposures that brain has in childhood. So when we look at substance use, what happens is if somebody uses something like marijuana, it causes a big release of a chemical called dopamine. And what dopamine does is it says, that felt good, we should do it again. And it causes a release of endorphins. Endorphins are what we commonly call the runner's high. Endorphins are actually the body's naturally occurring opioids, so they make you feel good. Things that go into and out of the brain relatively quickly are the things that make you feel better faster.
The biggest thing is the impact on reward reinforcement. If they are using that on a regular basis, whether they are feeling normal, whether they're feeling stressed, whether they're going through loss or disappointment, we know that that has a very strong emotional pull to it. And if you do it on a regular basis, it's a reinforcement and it's a pattern that people begin to get into. And before too long, their brain is saying, this is the solution for when I'm bored, for when I'm disappointed, for when I'm frustrated, and for when I want to feel happy.
So when we look at vaping, what's really unique about vaping is actually the way it comes into the body. So when somebody vapes something, what they're taking is they're taking a liquid that has some sort of chemical in it, whether it's nicotine or THC, and vaporizing it through heat, and then inhaling it and exhaling the excess vapor.
We know that when you vape, it allows you to be exposed to a higher concentration of the substance faster, which means that you're getting a stronger high quicker. And any time that you are exposed to a substance that's hits you harder, faster, it is way more likely that you're going to become dependent and have a hard time quitting it.
Research is really clear that the number one indicator of how likely someone will have a long-term use problem with substances is age of onset of regular use. So the more we can delay or obviously not use at all that, the more likely it is that someone will be able to, if they do use, not have a dependency problem from it.
The average age of first use is 12 years old, and that's of any illicit substance. We actually see a lot of kids that start using at very young ages, sometimes with edibles as young as 6 or 7, and including sometimes those things are given to them by their parents or other caregivers. I think the most important thing for educators, for family members, for caring adults in an adolescent's life is to be there for them, to listen to them, to understand what their struggles are, and to help them navigate some of these difficult situations in conversations they're going to have with peers and others in their life. The most important thing is to be available and to be able to direct them into healthier ways to cope with stress, healthier ways to make friends, healthier environments to work, study, and live in.
My primary message for adolescents is that just because it's legal in Michigan now doesn't mean that it's safe. especially not for your developing brain. Many adolescents have been at least trying marijuana, and so it needs to be a conversation that's happening, and it needs to be an open, honest conversation without a whole lot of judgment, so that your teens will be honest with you and so that you can reduce their harm long term.
The most important thing for people to know about marijuana is that while we have socially normalized it, it still carries significant risk for developing children and for adults alike. What we have seen over time is that we tend to not think of it as being as significant as other substances of misuse. What we have failed to recognize is that when we look at exposure in, say, nicotine, 1 in 4 people who try nicotine once, who smoke a single cigarette, will go on to continue smoking nicotine. When we look at marijuana, that drops to 1 in 10. So while it's less likely, there still is significant risk to people who try marijuana. And because we've had this kind of normalization of the use of marijuana and the fact that it is less likely to cause addiction and those negative consequences of having that disease, we still see some of the problems that exist otherwise. So the delayed reflexes, the difficulty driving, the increased risk for car accidents, the decreased ability to focus and concentrate on school, on work. And what we don't know, because we haven't had this exposure before in the past, is what that looks like 10, 15, 20, 40 years from now to those brains, to those current adolescents. And it's very different than the THC that was available in the 50s and 60s. The amount of active THC in marijuana today is 10 to 20 times higher than what was in marijuana in the 50s and 60s. We also see a change in the ratio of THC to CBD, and CBD is the chemical that sort of protects our brain a little bit from the THC, and as our THC has increased, our CBD has decreased, causing less protection.
Any smoke inhalation, being marijuana, tobacco, or vaping, will worsen asthma and it will worsen respiratory diseases. Even though vaping is, construed as safer than smoking a traditional cigarette, there are still chemicals in that aerosol, and it is still harmful to your lungs.
So when we think about children who have asthma or other respiratory illnesses, a lot of those can be made worse or can be precipitated by smoking around them or by themselves. It diminishes the body's natural defenses to keep the lungs and the nose and the oral mucosa of the mouth clean and filtered out from things like viruses and other particles.
Kids are going to use. We know that. And they're going to get caught. Not all of them, but they're going to get caught. So what do you do when that happens? I really appreciate schools that look at the idea of, hey, there's a suspension, because that's what policy is, and if you seek after some assessment, some treatment, we'll reduce that. It's a great external motivator to get people into treatment, because there are a lot of times where parents don't want the kids out of school for a week, 2 weeks, and they might actually want them in treatment as well. And so having that external motivator that's not the parent might be enough to push them to begin getting some help. Adolescents do not have to desire help for it to be effective. The NIDA treatment facts are really clear. Treatment does not have to be wanted for it to be effective. We have evidence-based practices that are designed around managing that, things like motivational interviewing. It doesn't mean that after 2 sessions your adolescent's going to come out and say, yeah, I'm ready to make all these changes. But what it does do is engages people into the stage of change where they're at to move them forward. Problems develop over a course of time, and it will take a course of time for it to help be resolved.
We want to be mindful that if we have too severe or black and white policies and procedures around substance use, we may actually deter adolescents from having those open, honest conversations that we want to foster so that we can help them with developing their good judgment, their good skills, because we know that an adolescent brain it just isn't physically developed enough to have the capacity to make those decisions. They may be looking for validation that not doing it is okay. They also may be looking to you for help. They may have tried something or been scared by something that they've seen at a party or with peers, or even scared of something that they've done themselves. So allowing them that space to process those emotions and to be a safe person for them to reach out to should they need help is the most important thing that we can do for our adolescents.
We know this for many people, starting using substances, they start doing that because they're dealing with things that are going on. So just having that eye and ear, a mental health first aid training for a teacher and being able to spot signs and symptoms early on can be very helpful to help prevent substance use through that positive youth development strategy.
Anyone who can have that one-on-one mentorship with the teen to know what their goals and aspirations are and really help be that positive role model towards having a nice productive life without needing to use any substances is incredibly valuable.
Despite the normalization of marijuana, we know that it has negative effects on the brain and physical health beyond the brain for a developing child. So what we want to be sure of is we want to be sure that in children who do use or in children who are experimenting, that we allow them to also have a safe place to come to process those thoughts, feelings, and emotion.
Any individual in a teenager's life, being that the parent, school, anyone in the community, who can be present to create a kind, safe, open, non-judgmental environment towards that adolescence experience is so important and is going to be the most influential to help build them up to have a fabulous life.